Good afternoon and welcome to today's Ministry of Health press conference. We will begin today with remarks from the Minister of Health, the Honorable Kim Wilson, JP MP. Minister, you can begin.
Thank you, honey, and good afternoon. Today, I'm pleased to provide highlights of the 2022-2023 budget allocation for the Ministry of Health. The ministry comprises 4 departments: the Ministry of Health headquarters, which includes the Office of the Chief Medical Officer, the Department of Health, the Health Insurance Department, and the hospitals. The Ministry of Health's vision is to ensure healthy people in healthy communities. The budget of $194,500,012 for the 2022-2023 fiscal year includes $147,251,163 for funding for King Edward Memorial Hospital and the Mid-Atlantic Wellness Institute. The Ministry of Health's estimates revenues for the 2022-23 year is $25,700,000, and the bulk of which will be accounted for by the travel authorization fees. The government's support for a healthier Bermuda is reflected in its commitment to universal health coverage. And for this, there's an allocation in the Ministry of Health's headquarters budget in the amount of $750,000 for consultants, and as well an allocation in the Department of Health's budget of $323,456 for health promotion resources. The ministry has an initial high-level year roadmap to strengthen our health system and achieve universal health coverage. The recently released Bermuda Health Strategy of 2022 to 2027 provides the strategic principles the ministry will follow in executing this key throne speech initiative. The Ministry of Health will focus on year 1 priorities of the roadmap in this upcoming year. This will begin with establishing the transitional governance structure needed for our health systems transformation, and that will include setting up new working groups for stewardship and collaboration. A key element of this is the Project Management Office, which is necessary to drive the change. This year, the ministry will also be working with our partners along several concurrent work streams. We will develop and pilot integrated essential care pathways, working with stakeholders to determine which patient journeys to pilot. The ministry will also establish the necessary baseline of our current health condition, which means bringing our health accounts up to date and determining our population's health needs. In parallel, we can begin identifying and prioritizing efficiencies and cost-saving projects across the health system. Part of ensuring future efficiencies is having a national digital health strategy to fully take advantage of technology and create options for consolidating the government's health plans. This is an island-wide effort to create a more efficient and value-driven health system where our residents enjoy better health outcomes. It starts with each of us doing what we can to live a healthier life. Living healthier lives reduces the burden on Bermuda's health system and produces economic benefits. In the upcoming fiscal year, the Ministry of Health will also continue to receive a budget allocation for the COVID-19 pandemic response in the amount of $767,803, which will also support the operation of the Bermuda Molecular Diagnostic and Research Laboratory, or MDL. From the 1st of April, MDL will come within the fold of the Department of Health, which already operates the government's central laboratory. The pandemic is not over yet, but changes to our border policies, largely enabled by good vaccination rates, both in Bermuda and in our gateway cities, should decrease the pressure on our island's health system and allow for efficiencies in the management of our response. These anticipated efficiencies are reflected in the reduced budget for the pandemic response. The Ministry of Health has a very busy year ahead with the start of health system transformation at its core. We look forward to collaborating with the wider Bermuda community to make this a success. Thank you.
Thank you, Minister. We'll now take questions from the media, and we'll start with Fiona McWhorter of the Royal Gazette. Hello, Fiona.
Good afternoon. Thank you very much. And thank you, Minister, for the press conference this afternoon. Appreciate it. I'm going to start off. You mentioned there that the bulk of the revenues were coming from travel authorisation fees. I did note within the budget book that it looks like an estimated increase of about $8 million this year with regards to the income from travel authorisation fees. With that being said, with it being a money spinner, can the government confirm that they will not go into the 23-24 fiscal year, or is that still open and up for debate?
Hi, Fiona. The Premier has recently announced, actually on several occasions, that the intent is that the travel authorization will cease to exist the next budget cycle. So it will be in operation for the 22-23 budget cycle, but it will end March 31st, 23. So will not be included in the next budget cycle.
I appreciate that. My understanding was that the Premier had said that it would go out of use at the earliest on April 1st, 23. But you're saying that, yes, that's a definite date. We can expect that the travel authorisation form or fee certainly will no longer be in place come April 1st, 23.
Correct. And like you say, it's the travel authorization fee. You're right, Fiona.
I appreciate that. Thank you very much. You mentioned figures there with regards to the work towards universal health coverage. One of those was a figure for consultation, and another, which I'm afraid I think I missed the first time round, was with regards to health promotion. If you'd be kind enough just to give me that figure again, and also to say a little bit about the ministry obviously has done a lot of work in health promotion over recent years. Unfortunately, it seems that it's not yet yielding the results with the levels of diabetes, kidney, heart disease, obesity that we're seeing on the island. How can you show or I guess give the public assurance that the money spent on that will deliver value?
Thank you, Fiona. With respect to health promotion, that's a very, very important element. You would recall when we spoke about the Bermuda Health Strategy for the next 5 years, one of the elements that's included in that deals specifically with promoting health, healthy living, healthy lifestyles, et cetera. Unfortunately, the statistics that you just relied on as it relates to diabetes and the high instances of obesity and the like are real. And unfortunately, that has caused tremendous strain on our healthcare system. So we are looking to budget in this year $323,456 earmarked for health promotion resources. Part of that will include, obviously, our engagement with stakeholders, because this is something that the whole community has to get behind with respect to promoting a healthier living and owning your own health. And you'll be hearing more from us in the next weeks to come with respect to a new initiative that's being produced as it relates to owning your own health. So we will continue to work with stakeholders for them to assist us in getting the messaging out. I understand from meetings that have been held from the Universal Healthcare Stakeholders Committee with some of the medical community that they're very keen to join hands, so to speak, and participate in this Own Your Own Health initiative. So there will be more information coming. But again, it's really important for members of the community to recognize that our health outcomes, unfortunately, are not very well at this point, but we all need to do what we can to change that trajectory.
It seems, though, as things stand, that message hasn't really hit home for a lot of people. It seems to be falling in some quarters, let's say, on deaf ears. So what's going to change?
As I said previously, with the meetings that have been held by the UHC Stakeholders Committee, particularly with the medical community, we are partnered, and they are very keen to again, join hands with the government so that we can try to address the issues and get more information into the public's hands as it relates to a healthier lifestyle. So we will be joining with our healthcare partners to try to get that message home. Unfortunately, as you said, in some quarters, perhaps people aren't necessarily listening to the messaging, but we can't let that be the reason that we don't continue with our health promotion and providing resources to that, because it's critically important. We're spending far too much. $29 million is spent annually on dialysis, and largely we recognize that is, in many cases, a lifestyle phenomenal. So we need to get the messaging out, and we will continue with health promotion and resources. Bermuda is not dissimilar to other jurisdictions, except for the fact is that we do have quite a high incidence of diabetes. We have 3/4 of our adult population, as you rightly said, are either overweight or obese. So there are other jurisdictions that are also challenged with this phenomenon. However, again, we will be continuing to work with our medical partners and our stakeholders to try to continue to promote the messaging of good health and to own your own health and the importance behind that.
Thank you very much. With regards to the molecular diagnostics and research laboratory, you said that's going to be coming within the Ministry of Health remit now. Some may have argued or may have thought that it already was. Can you give us some information as to why it originally fell under Cabinet Office and why the change?
As I said, the department already has an established lab, as the Premier indicated. It was several weeks ago, I think, when a very similar question was asked of him. At the time, the ministry was heavily inundated with dealing with things with COVID and related to COVID. And at the time, the decision was made that the MDL laboratory would come under the auspices of the Cabinet Office.
And presumably it just makes more sense to have it under health. Would that be correct?
At this point, yeah, because we're streamlining everything right now. And as I've indicated, because of our border changes and our high immunization rates here in Bermuda, as well as in our gateway jurisdictions, there will be quite a number of changes, and we'll see less reliance on the need for PCR. We're relying more on the antigen testing and the like. So we will just absorb the functions of MDL under the Ministry of Health coming the 1st of April.
Sure. Thank you very much.
Thank you.
And with regards to where we are now, we're talking about the budget. Less than 3 weeks ago, we would have expected this budget to have been delivered by Curtis Dickinson. He saw the island through the initial period and the initial impact of COVID, as well as some other major financial challenges that came across the island. And just wondered, were you sorry to see him go? Or to see him resign, I should say.
I think, as has been stated by some of my other colleagues, Curtis Dickinson provided stellar resources to the government, and his intellect and his commitment to the government, particularly in the role of Ministry of Finance, was very valuable. However, the government continues to operate. We recognize that the issues that Minister Dickinson was supported by a tremendous technical team that still works within the Ministry of Finance. The Premier formerly was the Minister of Finance previously, so he's worn that hat before. And we're absolutely certain that the government's commitments, as outlined in the throne speech, as well as in our platform, we will continue to move ahead and forge forward.
I appreciate that. That's everything I have. I appreciate your time. Thank you very much.
Thank you, Fiona.
Thank you, Fiona. Minister, next we have questions from Gary Foster Skelton of the Bermuda Broadcasting Company.
And good afternoon, Minister.
Good afternoon, Gary.
We can all see each other and hear each other. So, my first question, good afternoon, and my first question is to try and clarify something on page 41 of the 2022 budget. This year's budget shows the government's guarantee for the Bermuda Hospitals Board going up by $500 million from 276.8 last year to 787.7 million this year. Can you tell us if that is correct?
Gary, I'm trying to follow you where you are with the budget book. But,
page 40, it was page 41 of the budget as I see it. Bermuda government debt and loan guarantees.
Yes.
And towards the bottom, it shows government has the following guarantees. List them, and fourth one down is Bermuda Hospitals Board, 787.7 million. Are we looking at the same thing?
We are, Gary. However, I don't want to be difficult, but I am just providing an overview of the amounts. I would invite you to listen Monday. We're actually up first on Monday. It is a 5-hour debate that has been scheduled by the opposition. So I would invite you to listen. That all of the questions relating to the hospital, as well as the other departments of the ministry, will be identified in full during the course of that 5-hour debate. If you're not satisfied with the question, then you can by all means send us an email and we will address it accordingly. But I'm we are literally preparing the heads of debate as we speak, and I'll be able to address that in more detail during the course of the 5 hours starting Monday morning.
Very well, Minister. I just want to know, because that would be 500 million increase. I was wondering if it was a typo even, because I couldn't find that in the other figures.
Again, Gary, I'll address that on Monday. It'll be part of the budget statement, because I don't know. I can't answer that question right now. The heads of debate are being prepared by my technical team as we speak. So on Monday, there will be 5 hours identified for the Ministry of Health, and one of the heads that will be debated relates specifically to the hospital board. Okay,
I look forward to the clarification on that. Now, looking back, actually, nearly 4 months ago, following the throne speech, I asked about the wide variety of services that are available in Bermuda, and whether you can cut costs in terms of universal healthcare without reducing the number of services available. You responded by saying the Health Council has been tasked with tackling the overutilisation of health services by some islanders. Now, as you move forward with this intention for universal healthcare, can you tell us if the Health Council has reported or recommended anything further in their task to address overutilisation?
One of the items that you would have heard about when we released the Bermuda Health Strategy last week dealt specifically with savings, and I'm going to just quote it. And it dealt, hang on a minute, Gary, and it spoke specifically to one of the core features, which deals with overutilization and economies of scale. And of course, I can't put my hand on it right now. Mm-hmm. And that is certainly one of the 8 core features of the Bermuda Health Strategy that we are looking at. And part of the engagement will not only involve the Bermuda Health Council, but it will also involve stakeholder groups such as the physicians, the insurance companies, and patient representatives and other stakeholder groups. But one of the 8 core tasks of the strategy dealt specifically with the issues of overutilization. So that's one of the 8 core health strategy core elements that will be addressed. That's critically important, which is why it's in one of the 8 cores.
Okay, so but there's no further developments on that as of yet. It's still
I'm not even going to say that. There are many developments, because the stakeholder community, the stakeholder groups have been meeting, and the Health Council is just one of the stakeholders. Okay. And I will continue to report to the public where we are with that. But 2 weeks ago, when we announced the health strategy, one of the 8 cores dealt specifically with the issue as it relates to overutilization. So that is certainly one of the core elements of the health strategy that is going to be identified moving forward.
Very well. And the second question on that 4 months ago when we spoke, after the throne speech, you didn't address whether some services may be lost in the attempt to cut costs and create universal healthcare. Are we likely to see some services that islanders may have gotten used to being lost under UHE and therefore available only to those who can pay the extra?
It's way too early for that. You were part of the discussion that we had. This is still early days. We've come up with this beautiful health strategy. Please tell me you've looked at it. Oh, Gary. No.
I will say that's not been on my my particular beat these last few weeks. So.
All right. Fair enough. But the strategy is very detailed. It speaks to the 8 core functions that we're going to be looking at. It speaks to the roadmap, and it also speaks to a number of issues as it relates to early days. So we don't even know what the package will look like, because part of that will deal with, again, with our meetings with the stakeholders, but we have to do basically an assessment of what our health needs are in Bermuda so we can ensure that those needs are met in our essential packet. What I can also say, as I've indicated when we first announced this, is that there will always be a need for supplemental insurance. So we will be providing, as is outlined by the WHO, universal health coverage, essential care when you need it, but there will always be a need for supplemental insurance. We're providing essential packages, which will allow for preventative medication, et cetera, but there will always be a need for private insurance to augment that for supplemental insurance.
Okay. Now, again, this may again be one of those further down the line things, but you did mention previously looking at the potential cost savings in the Ministry of Health via merging of services, efficiency, digitizing of medical records. Said you didn't foresee job losses in the department. Do you have anything concrete that you know where you can save now, and you know how much you can save?
That's far too early. The throne speech was just a few months ago. The digitalization, I'm sure you would appreciate, will always result in cost savings because, you know, we're allowing technology to allow us to be more efficient. The beginning of the administrative merging of the government health insurance programs, the GEHI and the HID programs, combining those together will be economies of scale as well. By merging that, it'll allow us to look to source external resources such as overseas treatment, medication, et cetera, because we'll have more persons that are pooled together utilizing those government insurance packages. But it's still too early. But again, we did indicate in the throne speech that we would be looking at digitalization as well, which will again allow for efficiencies of scale by the use of technology, as well as the beginning stages of looking at the administrative merging of the GEHI and the HID insurance plans.
I still find it hard to understand when you say efficiencies of scale and digitizing, when usually that means less human resources, more digital resources. So I find it hard to see how we won't, will we simply be not losing jobs, but using less consultancy, less overtime to fix the physical problems? Where is that particular saving?
Well, as a non-techie, you know, as I have been made to understand, I've seen it, you know, in other situations, when you use technology, you're obviously creating more efficiency of scales. When we amalgamate look to amalgamate the plans, there will be almost 17,000 people that are either in GEHI or formerly in GEHI or on HIP or Future Care. So when we amalgamate administratively those plans, we will have economies of scale. We will have more people to be able to go to the industry and to our network partners overseas where further medical treatments are obtained to say, look, we are now negotiating on behalf of 17,000 people as opposed to the 4,000 people that are currently on HID, because we'll be amalgamating administratively all of the government plans. But all of those details, again, it is still the early days, and I appreciate your questions. However, it is still early days, and we will be continuously updating the public on the strategies and where we are step by step.
Okay. Well, I look forward to more of that. I want one aside that I want to make that I'm sure is of interest to some of the public that you may be able to answer right now. Are more Pfizer kids vaccines on order? As we understand, the kids vaccines expire this weekend. I know this is an aside from the budget. I just wondered. It
is an aside, and in about 2 hours, you'll be getting a statement from me concerning the latest update of our COVID stats, as well as where we are with respect to immunizations. And all that information will be contained probably in the next couple of hours. I
thank you for that.
You're welcome.
Back to the budget, just some figure crunching. Ministry of Health's 21-22 estimated cost expenditure went up by about 23 million. I understand 11.1 million of that went to the Bermuda Hospitals Board to cover shortfall. About another 12 million of that went on the ministry itself. So I'm just asking for a picture gleaming from previous budgets. It looks like you expected your staffing costs to drop to some of the pre-pandemic levels. So what did you have to pay for in this past budget year that you weren't expecting?
Okay, if I understand I think I understand your question. The last budget, you would note from the previous budget year to the package that I've just indicated that there is a deficit of $11.1 million that you rightly spoke to that was to the hospital previously. You may recall that when we increased the standard premium rate to address the shortfall of BHP because of the pandemic, obviously there were operational costs that were increased by BHP, as well as a reduced revenue because not so many people were utilizing the services of the hospital. So we do anticipate that there will be another $11.1 million for BHP. However, the government is committed to ensuring that that money will be received from the consolidated fund so that the hospital will be able to continue operating. You may recall the former Minister of Finance on the 10th of December in the House of Assembly also indicated that that additional shortfall will be funded from the consolidated fund to ensure that our hospital can continue its operations.
Okay, but there's also another 12 million from the original last budget's estimate for the 21-22 Ministry of Health HQ. The costs went up by 12 million to be actually a lot closer to what it was for 2021. I was just wondering what those HQ costs were.
Again, Gary, I'll be giving more details about that on Monday, but that's COVID.
Okay.
COVID costs, yeah, expenses related to COVID.
So we have an aging population, and you've acknowledged some of the chronic illnesses that we face. The budget made clear that this government wants more guest workers, which is one way to lower the average age and have more young to mid-age people paying into healthcare. But that's not a reality yet. Is your long-term plan for lowering the cost of healthcare, universal healthcare, things like that, even achievable if we don't see a substantial increase in the population?
You're right, Gary. We are looking at a very aging population. 1 in 3 persons will be over the age of 65 by 2039. So it is important that we're having less births. So we do recognize that it is certainly important for immigration policies to be presented to ensure that we have, making sure that Bermudians are employed within their country, but also we will require more guest workers to come to help to support our economy. And part of that support also includes paying into the MRF. The SPR, as you know, that comes out of part of your insurance package. Part of that, a large portion of that goes into the MRF. So which is one of the reasons the hospital saw a reduction, because there were less persons contributing because they weren't employed, et cetera. So we will certainly benefit from more immigration into Bermuda so that we have more persons that are paying into the MRF. However, having said that, part of the universal health care and part of what we're doing to cost everything out, and again, it's still very, very early days. So our costing is certainly going to be impacted by the amount of people that are contributing to the healthcare system. So that's a very important phenomenon that the government's committed to looking at. Immigration is critically important, and that's why you would have heard it feature in the budget statement as it relates to the challenges and the not so much the challenges, yes, but the importance of having more bodies in Bermuda, and immigration is going to be able to assist in facilitating that. No doubt you'll hear more about that from the Minister of Economy and Labor.
Well, my final question, I want to touch on the fact that we're only getting a very brief overview here in this press conference. You've said we've got to wait for Monday for more about the budget, and also with UHE, it's all in movement. But I'm just looking for a little bit more of perhaps a gleaming of an idea of what UHE could be, and because any movement towards more universally affordable healthcare requires either more money in the kitty, or a lower individual cost of services, at least to the less wealthy, or a reduction of said services. Can you tell us at this point which of these three feature most highly in the discussions you've been having?
Absolutely not. It's still very, very early days. And next time I see you, I'm going to give you one of these personally so that you can review it, because we did have a nice press. Okay. And your colleague was at one of our presentations a couple of weeks ago about this. So these are very important questions. But regrettably, we haven't done the work yet. That's part of the exercise of the collaborative effort that I've spoken about as we move forward. There's a high-level roadmap. We've identified the next 3-year roadmap, and part of those discussions will include that. But these are very, very early days, very early days. Unfortunately, we were stalled for 2 years because of the pandemic, so we've had to pick up again. And we have a very committed team here at the ministry, as well as all the other persons that were part of the UHC steering committee and the leadership group prior to that in 2019 and 18, when we were looking at the health strategy for 2019. So the 2 years has created a little bit of a gap, but we're now picking up and committed towards achieving the throne speech and the platform pledges of universal health care. But we need to see how better we can spend. We're spending over $736 million a year on our health system, and we have to find better ways to spend that money more appropriately so that we can not only improve our health care outcomes, because, unfortunately, we do have some very dire statistics, but we also have to strengthen our health system, and we know it's not sustainable.
And I thank you, Minister. One thing I would like to ask, are you even willing to set a timeline on when you're going to give a press conference and say, these are our first points, these are this is like, are we going to look in 3 months, 6 months time, we've got this draft outline or something like that?
At this point, it's very difficult for me to say when, but I have assured the public that I will continue to keep them abreast. You probably would be aware that many countries that have undertaken the commitment of transferring to universal health care spend many, many, many years. One country in particular that was the shortest, it was a 10-year progress. This is not something that's going to happen overnight, unfortunately, but we will continue to keep the country abreast. However, it is not. We didn't get these poor health outcomes overnight, and we're not going to, unfortunately, be able to reverse it overnight either.
Okay. Well, thank you, Minister.
Thank you.
Thank you, Gary. And Minister, that's the end of our media questions. Is there anything you'd like to say before we end the press conference?
No, I just thank the press. Again, Gary, I'm not going to put you on the spot, but I really invite you to go to the government website to look at the Bermuda Health Strategy, because I do think you'll find it very interesting, as well as provide some further information to you and any members of the public that haven't had an opportunity to read the Bermuda Health Strategy 2022-2027, which sets out the government's priorities as it relates to sustainability, as well as making sure that our health system is patient focused and so forth. So I really invite people to look at that. And again, on Monday, we will have a 5-hour debate on all the particular heads, which will include the Department of Health, Ministry of Health headquarters, the Health Insurance Department, the hospital, as well as there's one more and I just forgot. Sorry, but in any event, it's going to be on Monday for 5 hours. So I'd invite members of the public to listen as well. And those are pretty much our health highlights. And again, in closing, the throne speech initiative speaks specifically to the transition towards universal health coverage. It is going to be a multi-year endeavor. However, funding has been provided for in this year's 22-23 budget to allow for us to start that process with the engagement of consultants. Thank you, honey. Thank you.
Thank you, Minister. Thank you, members of the media. That concludes today's press conference.